So I'll be doing a treatment on trigeminal neuralgia. One thing I want to do is not to work near the jaw area, just because it can trigger some pain or aggravate his symptoms to be worse. Also, I'm going to be working on his neck, pec area, and his shoulders, all this area. There's hypertonicity in his neck, so I'll be working his occipital muscles, and I'm going to be working the scalenes in that area. I'll be working. Also, I'll be doing myofascial techniques on his pecs, and that's just to improve the pliability and the tightness of his fascia. Also, I'll be doing a trigger point in his subclavian muscle, which is just below the clavicle. And that muscle depresses the clavicle, so I want to elevate it to stretch it when I'm doing trigger point. So I'm going to be starting off with some techniques. I'm going to do static contact. Just give him a gentle touch. Just to open up the chest area. And then we do some stroking. Okay, so now I'm going to be warming up the tissues by using some effleurage. And you want to make sure that you bring the flow to the heart when you do this. Just going to do some serrating. Some muscle squeezing.
Shorter treatment? Shorter treatment?
Whatever I have. And then
I want to do some muscle stripping.
Got you.
Okay, so we'll just start off with some static contact.
Bring down the tension in the spine.
This would be an introductory technique. I'll just be putting some lotion on for...
And after you do muscle stripping, we would like to warm up the tissues again.
That would be what they protected.
Doing a trigger point, and it's just below the subclavius. I mean, below the clavicle, and I'll be doing a trigger point. Okay, just let me know when you feel that pain. Okay, and what would you rate that on the scale? To 1 to 10. I don't want to exceed a 7, so just let me know. 6. A 6? Okay, so I'm just doing specific compression, and I'm going to see if the pain has been a little bit released and the number has calmed down a little bit on the pain scale. So what would you say it's now on the scale? 4? Okay, so now I'm going to do some techniques to relax that muscle again. I'm just relaxing the tissue again, and then I'm going to go in, try to make it the number even more less than F4. So I'm going to go in again and see. Just going to get some of the oil off. Okay, I'm going to go in again. And is that where gone. So I relieve the trigger point. Now I'm just going to get back to those techniques. So I just want to. So now I want to stretch the muscle. So I'm going to elevate first and just push along it.
Need the whole space?
Okay, so I'm putting most of the elevation because that's put the muscle in the opposite direction. So I'm gonna hold that for 20 seconds, maybe 30 seconds.
What's going on, guys? Adjust the camera.
Okay, and now what I would do is put some heat. And then I would leave that on. I'll be checking in to see if it's too hot and if there's any discomfort. And then now I'll be doing mild fascia release on his pectoral muscle, just under his clavicle as well. And I'm just gonna do some fascial work. And this will help with pliability. So there's direct fascia you can also use where you pin one spot and you just pin it up. Is it getting too hot? I'm going to work on this side as well. Do some fascial restriction work, and I'm just going to do some mild fascia. So I'm just going to stretch this area. So for remedial exercise, I'm going to be asking you to do the pectoralis stretch, the door stretch. I would not like you to hold that for 30 seconds, do it twice a day. That will open up your chest area. And then I want you to stretch out your ski legs as well. And your SCM. Also, since you have the flexed shoulders in your anteriorly, you would do posterior glides on that joint, and to fix it you do a grade 3, but just to help with the to maintain the mobility in your joint, you would just do grade 1 to 2.